Adrian, thank you for your reporting. RSV is a virus that mainly impacts the very young and the elderly. Hospitals are seeing more cases among young children across the country. Upstate University Hospital Pediatrician Dr. Joseph Domakowski explains what the virus is and what parents should look out for. With RSV, cases usually start around Thanksgiving, with it peaking in February. But emergency rooms and doctors' offices are already busy with young patients.
It is the most common reason why infants are hospitalized, not just in the U.S., but all across the globe. About 2% of our entire birth cohort is hospitalized every year.
Dr. Domakowski says that's about 160,000 babies. But what is it exactly?
That's respiratory syncytial virus. That's why we call it RSV. Its name is long and really describes what it looks like when it's growing in a certain kind of culture.
Children with RSV will often have pneumonia and be wheezing. Dr. Domakowski says parents should be mindful when their child has an upper respiratory tract infection.
It always starts that way as a cold. But then a subset of individuals infected, especially the youngest babies, will go on to have lower respiratory tract infection in the form of pneumonia.
There are two challenges. The first, there's no treatment. The second, there's no vaccine. But Dr. Domakowski says his team has been working on clinical trials for passive immunization. They've been studying this for 7 years.
And it's working. There are preliminary data that suggests this is about 80% effective at preventing RSV lower respiratory tract infection, and it prevents the need for hospitalization.
Dr. Domakowski says he can't wait for this to be accessed in a broad way. If you have concerns, you can call your healthcare provider. If you feel it's an emergency, then he says you should go to the ER.